Hi, doctor.
Hello, hi Radhika. How are you?
I'm very well, doctor. How are you?
I'm good. I'm good.
I
You're
just
looking
love
beautiful
your
today.
red lipstick. It's
Oh,
so
thank
cool.
you.
It's fiery and it's so cool.
Actually, I thought red will make me little pop out. You're so beautiful, so I should also match up to it, no?
No, please. Thank you for the compliment. I will accept that. But you're looking stunning, doctor. I mean, and
Thank
needless to
you.
say, your skin is really glowing. So it's really really, Dr. Pallavi, a real privilege to have you with us. And first of all, I'm not sure whether I'm pronouncing this right. Is
What?
it melasma?
Yes. We call
Correct?
it melasma. Yes.
Melasma, right. Okay. So, Doc, thank you. And, without, getting, I know there are lots of questions to ask you. So, and I know you're very, very busy. So, I'm going to jump straight into it. So, what are
There's
the
a
causes?
small correction, I must say, that I'm basically from Patna and that's in Bihar.
Sorry, Patna. I said Pune. I'm very sorry. My apologies. I've
No problem.
actually been traveling and I'm a little over all over the space. But sorry, I'm sorry. You're from Patna, guys. It's Patna. It's not Pune. Okay. Uh, because if it was Pune, I would have 110% come. I was hoping. I was manifesting it that you'll soon come to Pune too.
But you're always welcome here.
Thank you. Sean does do a lot of shows there. I should just come in and just pop in for
Yes, I
for
have
a
seen him live in one of our conferences also. He's good.
thank you for that. Okay, Doc. Without taking too much of your time and too many questions popping up, actually. So, what are the causes of melasma?
So basically, as you rightly said, that these are the patches, gray to brown patches over your skin. And what is simply characteristic of melasma, you'll never see it one-sided. You'll always see it bilaterally. So that is something which has to be taken care of and just not be mistaken. Yeah. So, what causes melasma? Number one is your light. Whatever light you are facing, the indirect light, the sunlight, the blue light which is coming from your screen, then of course the uh, UV rays are the culprit. So photo protection is very much important when it comes to preventing melasma. Again, people who are in HRT therapy, this hormonal therapy, or people who are taking OCPs, that oral contraceptives regularly, though those people also are under a risk of having melasma. Then again, genetics play a role. So some people get it through their genetical, if it's present in the family, if there is a family history. Then again, taking certain drugs, like people who take anti-seizure drugs or hydroxychloroquine or doxycycline, such people also are under the bracket of having melasma or are at the high risk of having melasma.
Wow. And Doc, is that melasma same as hyperpigmentation?
See, melasma is a type of hyperpigmentation, but hyperpigmentation is an umbrella term. So we can actually quote melasma is kind of hyperpigmentation.
But okay, so Doc, like usually with hyperpigmentation, you honestly with me, I've sometimes just woken up and I'm like, what is this spot? And then I'll take a photograph and I'll send it to my doctor, saying, what is this? And then she'll say, oh, it's hyperpigmentation. What I do see is that there are really no signs of hyperpigmentation or symptoms. Does that also apply to melasma?
Melasma gradually happens. You will not wake up one day and just see that you have melasma. Okay. So basically, you can see a patch. As I said, it will always be bilateral on the both the sides. Then there are types of melasma, which is basically on the malar aspect or on the centrofacial aspect or on literally mandibular aspect of your face. So, am I using so many scientific terms?
No. You're okay. You're okay. We will
Okay.
follow you completely.
Yeah, then so yeah, hyperpigmentation is something which can happen due to multiple reasons. Like if someday you do not remove your makeup or something you applied which actually irritated your skin, you can get hyperpigmentation later. The next
Correct.
day.
Correct. No, Doc, I'm glad you are using the terms you're using because I think the whole idea of this podcast, this Insta Live is, to give them, science-based, medical-based knowledge. So thank you for that. Also, Are there any risk factors to melasma? When I talk about risk factors, I mean like if someone touches it, is it contagious, or is there like a peeling? Is there itching?
This condition is completely asymptomatic and a benign condition. You'll never, it will never turn into something carcinogenic.
Correct.
Neither it has any symptoms. You'll just see patches developing over your skin, and that is quite physically visible. And that's what makes you to visit your doctor.
Correct, Doc. So you talk about like being visible with patches. I think anything visible, that's there up front for you to see also kind of affects your self-esteem.
That's
And
true.
psychologically, it definitely has an impact. Why it's important to address the psychological problems of melasma. I'm asking in the context of like how do patients handle this that has been suddenly thrown upon them in terms of their self-esteem, or how do they handle it? What can be a medical treatment or a stage that they know when to catch it, how to catch it, how to treat it?
It's a very nice question, actually, because in the world we are living in, everything is actually what is visible outside.
True.
Half of our lives is on screens,
Correct.
selfies. So, yes, if you have a patch over your face, if you have hyperpigmentation over your face, melasma over your face, you'll certainly feel a little, uh, there will be a jerk in your self esteem, right? You'll feel
Absolutely,
that
doc.
I need to get it removed, or and that's how you visit your doctor. But sadly, there is something that melasma is not completely treatable. So
Oh,
you have to take care that you visit your doctor, understand that what is happening with you, what are the major factors which are responsible in their case while they're having melasma. So the doctor will advise you if there is certain drug they are taking, they can actually change that drug or reduce the dosage of the drug. Or if they are not using sunscreen at all, which is very common, still very common in our population, so doctor will advise you the right skin care, the right agents to apply, because melasma can be easily managed, but you cannot completely remove it. So
so wait.
yes, counseling also plays a very important role. So we often counsel our patients that, if you be very consistent with it, then certainly you'll win over it.
Right. So, doc, there's, how does one diagnose melasma? Like, how do I know the difference between, like you said, it's a part of the hyperpigmentation. It comes under that umbrella. But as a layperson, how do I know that difference? Okay, this is melasma, or this is XYZ, or like a fungal patch, or whatever.
Yeah. So, first, as I described, that you can physically appreciate it because it has no symptoms, no itching, nothing. It is not associated with any disease. So, you'll gradually see that you'll started developing patches over your face, and it is 99% to 98% bilaterally visible. Like, as I said, as I defined also, that over the malar aspect of your face, over the nose, then you'll see over the whole central area of your face, something over your upper lip also, then over the jawline as well, that is called mandibular. So you'll start appreciating that, those gray and black patches are certainly developing and they have very irregular border. So you'll feel like if something is spreading over your cheek or something is spreading over your nose. So that, and whenever you scratch or something, nothing comes out because it is a pigmentation, right? So then you visit your doctor, then we actually physically examine the patient, then we take the history, then we actually take family history also, as 50% of people have it because they have it in their families. Then we ask their what are the skincare they're using, what medications are they using, then what hormonal therapy are they in, so many things. Sometimes just using wrong cosmetics can also lead to melasma.
Oh my goodness. Okay. Okay. Wow.
Yes.
Okay, that's a new one. And doc, when you spoke about how you take their family history, what creams they're using, they're basically past and as of now is what you use. And after that, is there a specific line of treatment that people can have with melasma?
Yes, as I told you, you cannot completely cure it. But yeah, there's an array of treatment available where you can maintain it. So we start with photo protection. Then we do certain tests also because in some people, due to deficiency of D3, B12, hemoglobin, sometimes thyroid patients are very much, eligible to have high risk patients to have melasma actually. And then we run the array of tests. We give them certain medications like azelaic acid or cozic acid, ascorbic acid. Then vitamin C. Vitamin C plays a very important role in actually preventing melasma and treating hyperpigmentation. Then again, once we start with their skincare, prime their skin, and when we think their skin is ready, we start with certain procedures also, like chemical peeling, laser, then all that,
Got
step
that.
up
Got it.
their treatment.
So, Doc, basically, you're saying, what I'm hearing as a layperson is, there we can prevent melasma if we actually
Yes.
go ahead and take the right precautions.
Yes. So I tell all my patients that please apply sunscreen as essential as you're taking your bath or you're breathing. It is that important. And the kind of environment we're living in, where half of our time is in front of our screens or certain lights, photo protection becomes very important.
Wow, wow. So, Doc, this is, my eighth episode. And I think out of the eight episodes, I think I've done six on sunscreen because I think just
Yes.
sunscreen is so, so important.
Yes.
We've obviously now learned the Boots rating and we've learned, all of that. And we've
Wow.
really well broken it down. But again, like, it also in one of the sessions, they're saying that even if you're on the gas, cooking the blue
Yes.
flame, he's saying that that
Yes.
also should be a reason enough for you to wear sunscreen. It's not
Exactly.
कि मैं
Exactly.
बाहर गई हूँ धूप में, then whether
Yes.
it's cloudy, it's raining, it's winter, you're in your house, anywhere, wear sunscreen, wear sunscreen,
Yeah,
wear
there's a
sunscreen.
flying joke also that dermatologist, even during life and death emergency, they'll tell you to apply sunscreen.
I love it. Okay. Yeah, but I think that that is so important, right? I think, I was also one of those. I don't know. It's just a mindset. You feel lazy to apply it for some strange reason, but now, I've made it a part of my skincare
Yes,
routine.
and some people find it that it's a luxury to apply sunscreen.
Correct, correct. But in the market, there are so many now that I'm researching so many well-priced sunscreens available
Hmm.
and
Yes,
very
yes.
effective ones that you can use and buy, buy and use. So that's of course, guys. Again, I'm saying use sunscreen, use sunscreen, use sunscreen. I'm saying that for you, doctor. Actually, I'm
Oh,
being doctor's
thank
voice.
you.
Yeah. Doc, okay, so there are some misinformations about melasma and hyperpigmentation. I'm going to ask you them and please enlighten us one by one. Can melasma turn into cancer?
No, never. Yeah, such certain cancerous condition can mimic melasma-like appearance, but melasma doesn't turn into cancer.
Is melasma a hereditary disease?
As I said, genetics are involved, but it's like a loaded gun kind of a situation that you, till the time you pull the trigger, melasma will not happen.
Correct.
So if the triggering factors are not there, you'll not get it.
Doc, then the other one is melasma due to some allergy or an infection?
It is not an infection. Allergy, as I said, that sometimes when you use cosmetics which are non-regulated, they have mercury or they have certain irritants, or people are so fond of using steroids over their face, they are likely to have melasma because of that.
Doc, it's good that you use the word, people are using. So usually there are all these over-the-counter medicines, especially, like fairness treatments and the fairness creams that we have in the market. I don't know what there's an obsession with that though, uh, which can lead to serious side effects. Could you please explain the risk associated with these creams and why we should avoid them?
Yeah, so OTC products basically, many of them have a combination, like triple combination of uh, retinoids, then they have like a combination of other lightening agents as well. But yes, they have certain amount of steroids also. So what happens when you start applying steroids over your face? Initially, you'll be so happy that your skin is shining, it's brighter, and that's the loop. When you first apply it and you see within a week that there are changes over your skin, you keep on applying it for a very long time, despite of thinking that it thins up your skin, your blood vessels will be visible, your face will become super red when you'll face the sunlight. The whole periorbital and perioral area starts flaking, it gets burnt also. And later on, if you're applying it for a very long time and when you try to withdraw it, there's something called steroid withdrawal syndrome also. Your whole face will parch, it will become dry, it will ask for steroid. Like alcoholics, if you start withdrawing alcohol from them, they actually ask for alcohol. So similar things happen when you start applying steroid for a very long time. So I specifically tell my patients that yes, steroid is a magical thing, but only apply it when your dermatologist, when a qualified doctor gives it to you. Just don't apply it because a chemist has given it to you or a certain friend has advised you. No, never.
You know, it's strange that you say this, Doc. Now I'm actually connecting the dots. So I have a very close family friend who was applying a steroid cream, on her face, and also because of her under eyes. And it thinned it so much that it clogged. Oh God, it's just scary, but it clogged her teardrop, tear
Exactly,
ducts.
exactly. Because
And
what
she had
happens, no,
went
this
blind,
area, there's no fat beneath the skin.
and
So
she went blind.
anyways, yes, anyways, whatever you're applying is quite dangerous out here. So we give patients the minimal amount of things to be applied. Then, the way of applying things is different here. No amount of friction. A lot of things has to be explained to the patient. People think that going to a dermatologist will actually create a hole in their pocket, but that's not true. If you go to your dermatologist, they'll tell you certain things to be applied for your skin, basically saving a lot of money by just experimenting, because people are just seeing so many things over internet and applying random things over their face and coming with complications to us rather than for advice. And so many complications, it becomes more difficult for us to treat also.
Yeah, because Doc, I do remember, like, so, because I'm doing so many of the skin stories, so a lot of my algorithm is based on products, and there was this product from I think yeah, the Korean skincare has become the huge thing, right?
Yes,
And
yes.
which there is some vitamin C cream which looks like you have to use apparently a pea-sized amount, and then
Mm-hmm.
you have people like slathering their face on it in the daytime. They're not putting sunscreen and going out, and uh, some scary pictures have come up with that because I think they're just burnt and they're overexposed and they're red.
Yes,
So it's
you'll
kind
see,
of
you'll identify those people, extremely red-faced people.
correct, correct, correct. Yeah. And then, you just realize that, everything on Instagram is not something that you should follow on. What's your
Exactly.
take on this whole, Korean skincare?
Yeah, I was about to tell you. First of all, our skin is just not like Korean skin. So we should never ever think that, applying Korean products will actually give us the skin what Koreans have. There is a difference in our diet, there's a difference in our skin types, there is a difference in the weather. So everything is different. How can you imagine that, you'll apply certain things and you'll get a skin like them? The whole genetic makeup is different. So
Correct.
why do you want to mimic something what they are doing? Why can't you visit a qualified person to actually tell you your skin type, then your skin routine? We are available to help you, right?
Correct. And Doc, there's a lot of things that also people have started doing is, doing this whole skin routine where they actually
Hmm.
smother their face. Like, it's all over
Yes.
Instagram actually. So like they'll use first serum, then they use like first they say start so to cut it short, they say use like a serum, then use another, top it up with a thicker
Hmm.
serum, then you go with, a cream, moisturizing cream, then another cream, and then your sunscreen, like skin layering.
Yes. People
So
tell me they have certain names for it, like six layers, then 10 layers of skin
correct,
routine they are
correct.
doing. Yes.
Will this have an effect on like maybe activating your melasma?
As I told you, if you're not using the right products for your skin, then of course allergic reactions can happen to your face and that can lead to melasma. Yes.
So it's based, and also then people do not know like which ingredients, right? People are using glycolic so much more or
Yes,
retinol.
yes,
I just got to know there's retinol and retinal, like two different things
yes,
also.
yes.
So yeah, so guys, be very careful of what you all use, and if you all, and if everyone who's living in Patna, go see doctor. It's very, very important. Doc, I have a little surprise. My husband is here and he wants to say hi.
Oh,
Hi,
hi,
Adam. Hi,
hi.
Doc. I was in Patna just about 4 days ago. So yeah,
God, if I would have known, I would have come.
it was for a
Doc,
college.
if I had known, I would have come to you.
But you're always welcome, always welcome.
No, no,
Thank you,
thank you.
thank you, thank you.
And
But
husband
same
quietly
Shan,
keeps
since I
dropping
don't
on me
want
on.
to age shame you or something, but my childhood is all your songs. So,
No, no, no.
so
I'm very
many
used to that.
songs that are still in my playlist, and I keep on, listening to them. It's wonderful, wonderful.
Thank you.
I've
Yeah.
seen one of
I'm
your
glad
live
my songs have
concerts
got skin
also.
deep with you, Doc.
Okay, that's when we have to ask him to leave the
Okay,
screen.
okay, okay.
He heard Patna and then he was like, "Oh, I just was Patna. I want to say hi." I said, "Yeah, sure."
No, no.
Yeah,
Sure, sure.
yeah.
Great.
Thank you.
Bye, Doc. Bye.
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 Say hi to my friends also on
Yes,
Instagram.
yes, yes.
They all
Hello.
saying hello.
Hello, Soumya. Soumya Chaudhary. There is Sevani, Vicky. Sevani, Vicky. Sevani, Vicky Sevani. Okay, okay, okay. Oh, okay. Sorry, Doc. I'm going to just
Yeah.
quickly do this. So, say hi to who are the
No, no,
friends?
just
Everyone.
yeah,
Okay,
everyone.
okay. Hi, Vivek. Hi, I'm Madhu. Hi, Pinku.
Okay, we're done. Thank you.
Okay, okay.
Yeah. So, Doc, yeah, thank you so much. It's been actually a wonderful, wonderful session, Doc. But before we leave, I want to take home and want to give to our viewers uh, any remarks that you have where Melasma is concerned and you think that needs to be addressed in a more serious way and not to be taken lightly. Because I think a lot of people, I think more than they seek treatment because they're so psychologically affected. It hits hugely with your confidence and all of that. What is that one thing you'll want to tell them?
Simply that, melasma is quite manageable. So don't get depressed that now I have melasma and it will not be treated. And you just spoil your beautiful life just because of two patches over your face. Then don't fall for just random advices. Don't do any over the counter treatment. Please visit your doctor, a qualified consultant, and ask them what is the reason behind it. Discuss whatever there is in your head, and you'll certainly get a solution. So never ever let melasma win over you. Just visit the qualified person, and trust me, you can win over it.
God, thank you, Doc. That's just so nice to hear and so comforting to hear that there is light at the end of the tunnel. Doc, just
Exactly.
before we leave, just one more question: are there different grades of melasma?
Yes, there are different types of melasma and different depths of melasma actually. So
So when
the
we talk
depth
about
means
depths, are we actually talking about the layers it penetrates the skin in?
yes, yes, yes.
Okay. Wow. Okay, Doc. It's been wonderful. I'm sure I have a lot, people will be asking me a lot of questions after this. And I will pass them on to you, and it would be very, very helpful if, you would be able to answer it for them because I think,
Certainly, certainly.
you are the hope, that we look out for and we need. And thank you. It's been very, very informative. And it's really great to hear from you, Doc. Like I said, next time in Patna, I will make sure I come and say a hello to you.
Perfectly.
Yes?
I'll be so happy and so glad to see you.
Thank you. Thank you, Doc. It's been a pleasure, really. Thank you.
Same here, same
Thank you.
here. Thank
Thank
you.
you. Thank you, everyone. And guys, thank you, viewers, for participating today in today's session. Any questions, please ask me. I will forward it to Doctor. And stay connected on our beautiful Spotless page, skincare page. I do tag it on all my Instagram, live sessions. Join them for more depth. Follow Doctor for more advice. And I'll see you in the next session. Thank you, Doc. Thank you.
Thank you.
Bye.
Bye, everyone.
Bye.